In functional medicine, we have to look beyond the thyroid gland itself. If we think of the thyroid gland as a bit like a thermostat, we have to ask ourselves what's causing the thyroid gland to malfunction. In mainstream medicine, hypothyroidism would be treated with thyroxine, which is a medication. However, in functional medicine, we need to look beyond that. It is important to look at all lifestyle factors to help the thyroid gland become back into balance. Looking at lifestyle factors and then using appropriate supplements and herbs and even other therapies to improve thyroid function. For example, in Hashimoto's, many patients do well on a gluten and dairy-free diet. Of course, that's not to say that that's the treatment and that's all someone needs to do. For some people, it works very well with results achieved within weeks. For some people, it's much more than diet. We need to look at exercise and movement. We don't want to be doing too much because that can actually increase cortisol levels and affect thyroid function. We don't want to be doing too little either. Indeed, sitting is the new smoking, and prolonged sitting and inadequate movement can actually increase inflammation in the body. We need to make sure that people are getting enough sleep because sleep deprivation can also increase inflammation. We need to sleep for 1/3 of our lives. There are very many reasons why that's important. A lot of hormonal balancing happens when we sleep. A lot of detoxification happens when we sleep. Just like we have a lymphatic system in the body, there is a glymphatic system in the brain. These little channels open up when we sleep to detox the brain of the toxins that are built up during the day. If we don't do that and don't recharge, these toxins will continue to build up. There's much that someone can do to reduce their environmental exposure. This applies to anyone, but especially with those with thyroid conditions. For example, plastics such as BPA are known to affect thyroid function. Indeed, BPA has a similar structure to T3. Metals such as mercury, aluminium, lead, which are found in everyday sources and as well as in medical and dental procedures, can also affect our health and certainly thyroid function. Chemicals such as fluoride and chlorine, again found in everyday use in water, swimming pools, etc., can also affect thyroid function because they compete with iodine, which is also a halogen. There is much that can be done using lifestyle factors alone to help improve thyroid function. It may not mean that someone can come off their medication, but often we can at least reduce the medication, and in some cases, people can come off it altogether. Indeed, our approach in dealing with thyroid conditions isn't necessarily treating with medication as a first line. It's important to address the foundations first. That applies to any condition whatsoever.